Hi, everybody, and welcome to another amazing live session from AHF's 2020 virtual conference. I'm Leah Riley, the Executive Director of the Association for Healthcare Food Service. I'm super excited that you can all join us here today for another live session. Today, we're super excited to have Angela Mojico, Dr. Angela Mojico, and Nancy Lane with us to talk about retail trends and how to ignite them for your 2020 and beyond. Before we get started, I just want to say a couple of words. We are going to be today having a happy hour directly after this session, so I hope that everyone will be able to join that. There is a link within the session listing for the happy hour directly in our virtual conference platform so that you can open a Zoom call and then get on camera with us. We'll all be on camera, so no need to feel awkward about it. We're all kind of learning this new virtual world together. So we hope that you'll join us for that. And then before we get started, I just want to quickly remind everyone that you can visit the exhibit hall, as well as our sponsors and our exhibitors at any time, 24/7 throughout the coming 4 weeks. We do have an exhibit hall coming up next Tuesday from 4 to 6 p.m. Eastern, and we've added a new exhibit hall hour from 9 to 10 Pacific or 12 to 1 Eastern on Tuesday, August 25th as well. So you can interact with the sponsors at any time, but we do hope you'll join us for those live sessions when the sponsors will actually be online and able to respond to your chats and meeting requests very, very quickly. But outside of those hours, you can network with them at any time. You can chat to their booth at any time. And of course, you can make connection requests with their team members, explore their products, and download the things from their booth. So to get there, you just click on the exhibit hall tab from the main menu, and then you click on the booths themselves, and you are inside their virtual exhibit booth. So we hope that you'll all take a little bit of time throughout the coming days, and then of course join us for the live exhibit hall hours in order to network with the sponsors and see what great products they have to offer everyone. So without further ado, I am going to pass it off to Eric Lipset from Computrition to say hi and to welcome our speakers for today. Eric.
Hi everybody, my name is Eric Lipset. I'm the president of Computrition. Computrition is a proud platinum sponsor of the very first virtual AHF conference. Thank you all for joining us for today's session, Retail Trends to Ignite Your 2020 and Beyond, with Dr. Angela Mojica and Nancy Lane. We all know retail has been impacted by COVID-19, and operators like you have had to adapt to these crazy and weird times that we're in. Thank you for all that you've done, all that you continue to do for food service. You are our heroes. Please know that Computrition is here to support you however we can, whether that's in person, virtual, or our partnerships with AHF. We're here to help however. At this time, I'm honored to introduce today's presenters. Dr. Angela Mojico is currently the Senior Director of Food and Culinary Services at Johns Hopkins Health System. He holds the distinction of being the only certified executive chef and registered dietitian to practice at the doctoral level. He has worked for over 30 years in food service management in a variety of acute and long-term care settings. Angela is fortunate to have worked at such prestigious institutions as UNC Healthcare, Cleveland Clinic, and Johns Hopkins. He has taught at several universities, including his most recent position at the UNC Gilling School of Global Health. Nancy Lane is the Senior Designer of Visual Merchandising and Product Concepts with Lakeside, Multicuria, and Allserve. Nancy works to deliver food service solutions operators who are in the trenches. She is also a designer specializing in visual merchandising and product concepts and has experience working with operators in all food service markets. Nancy is currently working with food service operators on reopening research and plans to support the function of safe post-COVID in these new atmospheres. All right, that's it for me. Angelo, it's all yours. Take it away. And everyone, I hope you have a great session today.
All right, let's see. So I have control of the slides.
You need to share your screen.
Oh, I gotta share my screen from here. All right, I can do that. I know you told me to, but So first I want to say thank you for the kind words. Although I would say that it's the second best kind words I've had in the last week. Last week I was at one of our hospitals and I had my mask on and I had my glasses on and someone thought I was Dr. Fauci. So there's something good about having this gray hair after all. I just wanted to share that because it made me feel really good. So let's talk about some retail trends that we have worked through and that we will be working through in the coming months. I want to kind of thank everyone and kind of recognize how interesting it was over these past few months, and really not talk about the things we did so much because we all did them. But what was interesting to me was that we all seemed to do some of the same things. It wasn't part of our disaster plan and it wasn't part of some sort of policy or procedure. We just knew it was the right thing to do and we did it at the same time. And when we talked to some of our peers, we said, what are you doing? Oh, I did the same thing. We closed our salad bars. We got rid of our self-serve soup, some of those things. And it was just interesting to see that although we did work with each other to fine tune those things, it was interesting to see that we did a lot at the same time. But what I'm mostly going to talk about is what we're doing to relaunch. So this is a slide I just have to share. This is one of our facilities. And you see there's 1, 2, 3, 4, 5, 6, or 7 tables that are perfectly socially distanced and nobody's sitting at them. I hid the faces to protect the innocent, but there's 5 or 6 people that are gathered together. And it just goes to show that we have challenges and we have to work through those challenges, even if we set up perfect programs. And for those of you who've been in food service for a number of years, you're used to those kind of things. We have to have foolproof programs or we're going to struggle. So what are we going to do to respond to these challenging times and make our operations better for the future? So I didn't want to talk about some of the things you're already doing because you're already doing them. I really want to talk about, so how did this benefit us in some way? I know COVID was bad and that didn't benefit us, but what are some of the things that were good in a food service aspect about what happened during COVID? So my first example is self-serve soup. So anyone who's been in food service would know that this is a picture, not of consomme, but of beef barley soup after we've allowed people to serve themselves. Because as you know, people take the guts out of the soup and they leave it with just broth. And then they complain to us and say, hey, there's no stuff in this soup. I can't believe you're serving this, poor quality product. And so having to serve soup is a good thing. It's something that whenever we design new cafes, wherever I've been, I recommend not to serve soup. And, it's bumpy for a couple of days. During COVID, it wasn't as much as normal, but it does, people then get used to the fact that, hey, we're serving you, but we're actually serving people a better quality product because it's more consistent. So I'm very happy that we're able to forcefully remove that without any pushback. The next is salad bars. So there's a great example. This is the Johns Hopkins Hospital, and they had a tremendous salad bar. And now we have a discotheque where the salad bar used to be. It was difficult at first. And there was a lot of discussion about, we moved to all grab and go. We did it like everyone else did. But what do we do next? And I see on the message boards where people are saying, well, I guess we'll just stay with grab and go. People are used to grab and go now. And I really think that we need to give people options and people want to still make choices. And so what I'm recommending at our facilities is that we launch salad concepts. And here's an example of our salad concept, the Greens Project. And this is the first of 2 slides of all of our toppings that we offer. And we serve it for you instead of you serving yourself. We've wanted to do this for years. I remember working in Washington, D.C. years ago and watching a patient drag their IV pole and their cords running through our entire salad bar. We had to throw everything out on the salad bar. So why would we ever have a salad bar anyways? I mean, I know we know those things, but we never get rid of them because it's profitable. People like it. They like to make their own choice, but is it the right thing to do? And when we launch these concepts, I'll just move to our next slide, we get great reviews. Our customers love it. They love to be able to make the choice. We launched this at Bayview in our health system, and it's been wildly popular. It's one of the most, if not the most popular concept we have, just giving people choice. And, you know, they get to pick what they want. They get to build their salad up. And when people go with a base salad, they tend to just get, you know, they'll get a base salad, it's only $4.99, but then they wind up getting something else. If they build up a big hefty salad, then they don't do that, but we wind up benefiting either way with pretty decent sales. And so this is a picture at Bayview. I think we have around 60 toppings, and we build the salad for you. And 2 of our other facilities, we're looking to incorporate this same concept in the next month. And we had to just put plastic up in one space that was a self-service salad bar. And in another space, we reconfigured one of our spaces, and where we have enough cold wells, but we're going to add ice to some other wells, and we can make it work. It's not that hard, and it's going to make our customers very happy because we're going to give them back choice. And so I think that we have to think about our future and what we want to be. And you keep seeing articles talking about, you know, is the salad bar gone? Well, it should be. It should have been gone a long time ago. So now is a good time for us to push that forward. So it's a benefit for us. We get to kind of, you know, talk through. Maybe it takes a couple of dollars to you know, retrofit your space. Maybe it takes a little bit more than that, but I think it's the right thing to do. So next, in our retail seating areas, this is interesting. It came from one of our chief operating officers, that at their facility, as a means of spreading people out, they realized we had some of these high tops in the cafeteria just so people could look out the window. But then we realized that we have hallways that have good views too. And we can, you know, you can come up and charge your phone, and we can put 2 or 3, depending on socially distancing, seats at these spaces. But we have spaces in our organizations that can allow for this. And so we're seeing where we're getting creative about seating, because we can't have that many seats in our cafeteria. So again, this is a good thing. It shows that people are eating. It drives them to the cafeteria, which is what we want them to do. Okay, so then next we actually are looking to finalize our online ordering app. And this is a good thing for us. We wanted it for a while, but when COVID hit, we realized that we needed it. We actually did some modeling at several of our facilities, and in one of our largest operations, you know, we're looking at no more than, I think it was 12 people allowed in the cafeteria at one time to do it correctly, to have people distanced and stepping out from the stations and not banging into each other, and going to the cashiers and, you know, getting in and out of the space. And so we realized that we actually have to shut some of our larger cafeterias down in order to make sure people are distanced. So then we brought back up the app idea, and it reduces the number of people that are in our retail spaces, and it makes complete sense. It helps with social distancing, and it gives us the opportunity for contactless pickup. We're actually looking at the lockers, the electronic lockers that you may have seen at some of the food shows, and that's going to allow us to put food in on one side and a guest to pick food up on the other side. And so I think it's important for us in the long run. It's going to ultimately help our sales, as it did with Starbucks, but, you know, this is an opportunity for us to rethink what we're doing. Now, having an app gives us some other opportunities that we wouldn't have been able to do. So ghost kitchens, when you start to think about having an app, and let's say we have a cafeteria that only has 3 stations, and one of our spaces has a grill, a hotline, and sushi. They're waiting to get renovated, but at this time, that's all they've got. So why don't we offer items off our patient menu? And what we have to do is put a printer in the back of the kitchen and send those items out to the cafeteria to put in the locker. And now we've got additional items on the menu to entice our customers down. And then pop-ups, we can make whatever we want. If we're sending it out of the back of the kitchen, we can set up a steam table in the kitchen. We can set up, you know, cold wells in the kitchen. I just gave an example of tacos. You could, you know, all you need is crunchy meat, you know, taco shell and some sort of sauce, and you can make tacos all day long with things that are already on your tray line. And so we have the opportunity to be very creative with items that we didn't have space for or necessarily had staff for. And now that some of our patient volumes are down, we can actually manage some of this. So I think it's an interesting thing for us to consider. Oh, I don't know how this picture got in. I was doing another presentation for one of our culinary folks who were presenting to AHF, and this must have snuck in there. Sorry about that. So the next thing the app helps us with is potentially labor management. And this is actually the layout of one of our renovations it's actually in play right now. And this is the end state. So we're putting our pizza program in, our salad concept is going in. We have a health food concept we call the chef's table. We have a grill, sushi, and a deli concept. So we have 5 concepts besides grab and go in this space, but we're only currently staffed at nights to have the grill and 1 cashier. So now we have a beautiful pizza oven and we have this great sushi case. We have all these things going on during lunch, but then nights and weekends, we're only serving 1 set of items, 1 concept. And it's just not fair to those staff. So what we did is we started to think if we put the lockers either outside of the cafeteria and a kiosk to be able to come down if you don't have the app and order and use your credit card, we now have a cashier and a grill person, so we can use them both as food servers. So now we can put 1 person managing pizza and salad, we can put another person managing the grill, the deli, and then they share the hotline. And so now we can add 5 concepts without adding any labor. And of course, the volumes aren't that high at nights and weekends, so I doubt we'll need to put the 3rd person on, but if sales dictate that, then of course we will. But now instead of adding FTEs in a time when it's going to be difficult to ask to add FTEs, we were able to get creative and do this. And so we're looking at this at a couple of our locations because I think it makes sense. Yes, some customers like to shop and look around and touch their food and see their foods. But with COVID, people are getting used to just ordering food and having it delivered, or ordering food and picking it up. And ultimately, I know for me, I just want good food. I'm not as concerned about the experience when I know I just want to have good food. If I could have 5 different concepts to choose from, or 1, I'm going to pick 5 concepts because I want some variety. So this kind of takes me to, if we're going to have these new concepts, we have some time on our hands. What are we going to do with that extra time to get better, right? So this is where we're talking about taking a bite out of our current programs and thinking about things differently than we have in the past. So BITE stands for Better Internally Developed Than Everyone. And it's interesting when I bring this up. I remember going to one of our facilities when I first got here, and I said, what do we do better than everybody? And the initial reaction with the team was, well, how dare you? Like, how dare you say that? I can say something about my mother, but you can't say something about my mother. And so they were offended. And I said, well, no, I don't mean it that way. What I mean is, what are we really proud of? What are we so proud of that we say either we're just as good as anyone who does this, or we're better than everyone who does this? And if we don't have that today, let's get together and figure it out and have that tomorrow. And so it's really important. I also mentioned to chefs, it's a little bit of a side story with them, is, who's your culinary mentor? Is it someone from the Food Network? Is it a chef that you trained under? If you would invite them to taste the foods that we make, then that means you're proud of the foods we make. And if the answer is no, that you would not invite that person to us, then we have some work to do. And that's really what it's about. It's about, developing concepts that we feel really strong about, that we vetted and tested ourselves on, that we really, really push ourselves to get to that level of quality that we need to be at, that we can say we're as good or better than anyone. So here's an example. You may have seen this before, but this is Rocco's Brick Oven Pizzeria. This is our pizza concept. We played with it for a long time. I remember when we started, we talked, our chefs and our whole team talked about, where we're going to buy dough, what are we going to do about the cheese? And the answer was, we're not going to buy dough, we're going to make dough. We're going to use Caputo double O flour. We're going to use San Marzano tomatoes. We're going to use the best fresh mozzarella, and we're going to make a classic, perfect pizza, and our customers are going to love it. And when you look at our pricing structure, it's just incredible. We still have a great margin on it, but we're charging $5.49 for a margarita, and out in the world, that's a $12 or a $14 pizza. So it's value. So we ring the registers, we do a good amount of sales for these products, but we really focused on the quality. There was a point, and I'll show a picture just so you can see it, but that's our pizza oven. I'm not trying to advertise, it just happens to be the picture I had. And that's a picture of our pizza. It's fabulous. It's as good as anybody can make. We use fresh mozzarella because it spreads better. We use less of it. Our whole pie is about 12 to 14 inches and it's only 700 calories and there's only 2 ounces of cheese on it. So it's an actually, a healthier pizza, if you will, but we really focused on quality. And I remember when we launched the program, everybody in the kitchen, every food service worker, every cashier, every tray line worker made a pizza because we were going to focus on quality. And I think we have to do that in order to move forward. And this is a good time because our volumes are down. So let's focus on quality. Let's get back to the roots of what makes things perfect. So this is an example of some of our concepts. These are some of the concepts at Bayview. And I think you got to be honest with yourself. And I went through them and looked at them. And, the Greens Project I showed you, it's as good as anyone can do, right? I mean, we're doing grilled salmon, we're doing chicken, we're doing, beautiful, nice toppings. It's a value, it's healthy. I'll speak about the healthy piece in a second, but it's a great program. The Roccos I just mentioned and showed you, it's as good as it can be. In fact, I think the food management just showed one of our other AHF members launched a pizza program using the same oven. And so they came and visited us and we were talking on a conference call with all our directors. And I said, you know what? We did such a good job with the program and we executed it right. Our pizza program just had a baby and our baby landed in Long Island. And it made us proud that, they thought enough of it. We executed it correctly and they felt it was worth buying an oven like that as well and launching a program with that level of quality. AJ's Deli is our deli. It's a great deli. It's simple, but it's perfect, right? It's, make a good chicken salad. We have a faux chicken salad with these veggie shreds. That's fabulous. And then we just have really good quality deli meats. We build a sandwich that's $1 less than what Subway's serving and worlds better. Our sushi program is something we bring in, but it's important to us to be our way. So our sushi is it's very important that we don't use a lot of spicy mayo and a lot of crunchy fried stuff on it. And we will torture our sushi vendor if they try to do that because we know that sells for them because that's what Americans want, but we want to see the fish. We allow them about 10% of that and we check their taste to make sure it's right. So we feel really good about those concepts. But then on the other side, we still have some work to be done. We have a great grill concept, but sometimes our team members want to cook burgers up ahead of time. So I don't think it's green yet because I don't think we're perfect yet. And that's what we have to strive for. We have to say, are we taking a bite out of Prime Grill? And if we're not taking a bite out of it, let's work on the things so we can feel like, we're really where we need to be. Our Super Bowl concept is really great. We've got a variety of bowls. I mean, I think we're up to 8 now. They're all really good, but I think we need a little bit more authenticity on a couple of them. Some of them are dead on, perfect, but again, you need to challenge yourself and push yourself to be the best. Lemongrass is our Pan-Asian concept. Again, I think it's super. I just think it needs a little bit just to push over the edge. And then our chef's table is being reworked currently. That's our healthy food concept that's under 700 calories and low sodium and low saturated fat and all of those things. I think it's a great concept. And I think it's actually shocking that we'll sell about 20 portions less than the bowls. So it's pretty interesting that it does so well without calling it healthy. And so it does well by itself, but I think it needs a little bit more work. So I'm going to just talk about this in a little bit. And this is just kind of getting on a soapbox. So this is an interesting thing that's come up during COVID, and it's made me think a lot. I've thought about it a lot before because of a healthy food discount program that we have at one of our facilities. And what we realized there is that people want to eat healthy, but sometimes can't afford to eat healthy. So when you look at the social determinants of health, there's a lot of different models out there, but it's how do we look at health? It's not just one thing, right? It's your environment, where you live. If you're in a dangerous neighborhood, you're not going to go out for walks. How much money do you make? Your economics, your social environments. Are you getting out and talking to other people? Whether you have healthcare or not, and how good is that? And how are you able to manage whether whether you have diabetes or some other issues? Education we know matters, and of course food. And so it shows up on most of these social determinants of health charts it's usually either in with healthcare or it's separated by itself. But what's come up a lot in our organization is that folks are struggling during COVID. And I remember someone mentioning recently that our employees that make less than $50,000 a year are having a hard time during COVID. Well, the reality is they're having a hard time during COVID, before COVID, and likely after COVID. So what are we doing to make that better for them? And so we're doing some things at our organization that's going to help support through COVID, but what are we doing going forward? And we're working on some research, and there's 2 studies that we're going to be looking to do at Hopkins, and one of them's around healthy food discounts, and we've been managing that program for a number of years, but now we have data that we want to share. And so we found that when we just discounted items and didn't call them healthy, that people ate them more than when we called them healthy. And then when we actually called it out in such a way that it's more about the discount than it is about the health, we actually got an increase in sales. So in the beginning of our program, we were in the 20s in terms of the percentage of checks that had healthy items on them. And then at the peak of our program, we were as high as 37% of checks. And all we did was little simple things like using behavioral economics. So we just, after you check out, we'd say things like, you just saved $1.50 by making healthy choices. So that's a feedback loop. So next time you make healthy choices, so you save money, not necessarily making healthy choices because you are thinking about healthy choices, but it's because you want to save money. And because of that, we win anyways, because people make healthy choices, they have better health outcomes, and it ultimately helps our benefit program and our insurance program and all of those things. The second study that we're going to work on is related to these I'd say ultra discounts, but essentially discounting items to the point for a certain subset of population, for environmental services workers, food service workers, those people who we determine are at a certain income level, because what we found with COVID is people at certain socioeconomic groups are more affected because of their underlying health conditions. So if we can help, it's a small investment compared to what we're spending. So when you think about things like, yes, we give an extra, let's say 20% discount on a chicken sandwich. The first thing one of our C-suite members is going to say is, we can't do that because, we have to make our profitability. But when you look at it holistically, and we gave 20%, I want to say at one of our facilities, let's say it was $100,000 in healthy food discounts, we'll pay that back 5 or 10-fold, and that's what we're hopefully going to find out by helping people to not have diabetes and to people have manage their diabetes better and have lower A1Cs. Just think about one amputated foot or one open heart surgery, what that costs for our insurance. So it's going to pay for itself, similar to like a WIC program does. And so that's what we're going to study. So it's interesting because our team members are the ones most affected. And that is all I have. Stop sharing, right?
Thank you. That was really interesting. I took down quite a few notes. Always love to hear you with your ideas, Angelo, and thank you so much. My name is Nancy Lane, and I'm here to talk about retail trends in food service. We're going to talk about ordering food via the smart device, outdoor seating, micro markets and pop-ups, modified menus and hours, and repurposed equipment, floor and wall signage, and also social distancing, physical distancing, and robots. So ordering via smart devices, you can see here that the mobile ordering has really taken off. On Tuesday, if you remember the keynote speaker, he really talked about mobile ordering was before COVID. Yeah.
Nancy, I'm sorry. Could you just share your screen?
I thought I was. Let me double check here. Am I sharing it now?
No.
Ah, sorry.
There we go. Okay,
Yeah,
perfect. No
we
worries.
got
Just
it.
wanted to make sure that
Thank
everybody
you. Sorry.
could see. Sure, no worries.
Okay, here we go. We'll start again. We want to talk about the ordering via smart devices. So again, on Tuesday, he was talking about before COVID, the mobile ordering was really starting to take off. After COVID now, you're seeing more of it than ever before. You know, touchless, contactless, payless. You know, there's just so many things happening with this. So you're going to see more of this in the future. A new one that just came up too is queueless, and this is just helping you when you want to have people queue up. They don't have to be standing in line. They would get a text message and telling them when to get in line or to pick up meals or meals to go. So again, there's a lot more with the mobile devices. Coke just came out with a contactless freestyle machine. So they have their freestyle machine, and what they did is they put an app out there. And I was talking to a director, and they were going to get rid of all their self-serve beverages and go totally to bottles and cans. And then Coke has this app. So what you do is just scan it. You tell the machine what you would like, and the machine will fill the drink for you. And then you can go ahead and take your drink. So you can get a variety of different things from their freestyle machine, and you don't have to touch the screen. Outdoor seating. I know you're starting to see this quite a bit. You're starting to see more of the outdoor, especially with restaurants in small neighborhoods, or you know, where they're closing down streets and getting people outside. Up in the right-hand corner, this is at a hospital where they put the grill outside, and they've got some areas set up for outdoor seating. And then you're seeing a lot more with big tents being put up. You're wanting people just feel a little bit safer outside. So if the weather is nice weather, it's great to be outside to, again, eat your meal. Here is called a Pop Mart. This is another thing that came out of COVID. This is kitchens to go. A lot of manufacturers are making, you know, great solutions to solve some of the problems that we're having with trying to serve people and keep people at social distance. So this is just a nice little pop-up market. And again, it can be used for like a mini grocery store. It could be used for a pickup station, pre-packaged meals. You can see that down at the bottom here, there's 2 tabs. That would be where the forklift could pick it up and move it. So if you wanted to move it around on the ground to some other location, you could. And right here, you can see that there's somebody standing in line using the hand sanitizer. So again, just making sure that you use hand sanitizer before you enter this area. So this is just a nice little, again, pop market that is popping up. So talking about pop-ups, you know, this has been around for probably about 2 or 3 years. And, you know, there's a lot of things that you can do. And, you know, like ghost kitchens, the same thing, the same concept. There's specialty coffee, there's breakfast, grab and go healthy snacks, noodle bars. Again, a grilled cheese and soup, that might be another one. But make sure that you have a portable hand sink in this area when you set one up. This one was set up in a lobby in less than 2 hours. We were able to get it all set up and running. Make sure that you have your electric, that the units will fit through the doors. There's just a little bit of prep work you want to do ahead of time. But this can be, you can tear it down and move it to another location if needed. So mini markets, micro markets, the food lockers, smart fridges, that's all the rage right now. You're starting to see this in all the food industry. This is at one of the hospitals. Again, it just makes it convenient for people to be able to take their food, take their meals home. They don't have to make another stop. Restaurants did the same thing. You know, they opened up little grocery stores. So all the markets are really trying to make it a lot easier for customers and staff to be able to take their food and go. This is another mini market. This was with Ford Company. They had 89 of these across the country, US and Canada. So they're putting them in all the B&Is, trying to keep people in their buildings so that they don't all get into the cafeteria. So they're trying to keep people spread out. Simplifying the menus and reduced hours. You're seeing a lot more done with reduced hours than ever before. This presentation here on the left is a great example of merchandising. I love it. You still want to merchandise the food and make it look great. So by tilting that toward the customer, you can see the chef there. That food looks fantastic. Even though it might be take it to go, you still want presentation. Put it in a nice serving vessel. You just don't want to set the pans out there. So again, pull out the nicer pieces of merchandising or serving containers. It just looks nice. And here's a great example of bento boxes are back, stronger than ever before. The fresh salad there at the bottom is made. It's a nice display. That might be your display salad. Again, I know Angela was talking about those salad concepts. I love that idea. All that brightness with that fruit and the vegetables was beautiful on his salad choices. And to the right, you can see a nice display there with the pizza. Again, this might just be a melamine platter, but it's a nice display. It just displays extremely well. And his pizza looks fantastic. And here's to-go containers. So it's proven that people, after they pick up their meal to go, it's about 20 minutes before they sit down and eat their meal. So in that 20-minute time, you want to make sure that the food travels well, the quality holds up. It's very important. French fries in a styrofoam container will not make it. So really look at if you've got meals to go or take out or take home, that they're going to travel well. Over to the right, you can see those are bamboo plates, and they're a disposable, and again, disposable lid. But that display just looks extremely nice, and it travels well. Another one that was discussed is soups and liquids. So those are a little bit trickier. There's nothing worse than to get back to your desk or lounge area and then, have the soup leaking out. Repurpose equipment, very interesting. This is a deli case, again, talking about those salads. People miss their choices from salad bars. This display looks it's very eye appealing, and it draws the customer in. And again, it's going to give them choices so that they can choose a salad and get the ones that they want. So repurpose some of that equipment. You're starting to see people looking at their equipment and thinking outside the box. Here's another great example. Again, this was a cart used to serve meals, the trays. They repurposed it and made it into a little mini cafe, which I thought was really interesting. They take it to the nurses' station. They also might catch a couple of the visitors. I know visitors are starting to be allowed back into the hospitals. They move it from floor to floor. So they're taking the food to the customer or the staff. And, so again, just repurposing a piece of equipment that you may already have. And this is another great example of repurposing. Again, thinking outside the box. This would be one that you would take the food to the customer. So we're starting to see more food being spread out and taken to the customer than ever before. This could be a dessert bar, an ice cream bar. It could also be a hot dog stand outside, if you're doing grilling or you want to have some sides. So again, look at some of your equipment to be multifunctional and reused in different ways. And off to the right, you can see again from that cart, there was a nice little dessert bar, and it's very eye appealing. You got the fresh strawberries, the watermelon, the cookies. People do eat with their eyes. And again, to the left here, you've just got some nice ice cream carts. One is for Sundays, and one's just a little ice cream cart that's going around. So there's just different ways to use mobile food carts. And also, carts are being motorized. More manufacturers are putting motors on their carts. So it's easier for you to move it from building to building, floor to floor. And again, it's just got a couple speeds there, rabbit or turtle speed, so that you can move it to another location by a motor. This is a great example of underutilized spaces. There's a lot of lobbies and areas or rooms that could be utilized for a nice cafe. And again, most of these pieces are all mobile. They're put in place. They look like they're all built in, but they're not. They're individual, and then they're mobile with the skirting on the bottom to cover the wheels. So very easy to set up a nice little cafe in a lobby area. Look at those underutilized spaces and think about that. Easy Tow, this is another one that came out of COVID. You know, finding a solution for a problem that somebody was having, and they wanted carts to be able to lock together, so they are hitched together, and you could tow 3 of them, and then you would drop one off at a location, and then come back and pick it up, and then go back and restock it. So it could be for meal deliveries, it could be for catering, it could be for multiple use applications, but again, it was, we need something that will solve this problem where I've only got one staff that can deliver, and how can I have multiple carts? And also talking about floor and wall signage, very important as the customers enter the cafe. You know, you want to make sure they know the limit, how many people are allowed in there, what time that they can be in. You know, at most of meals, people are taking it out to go. And should they wear a mask? Not, you know, so again, you want to make sure when they walk in, they understand the rules of what they need to be doing. And if you go to the left at this location, you're going to get pasta. If you go to the right, you'll get a grill product. So they've got it marked with different colors. So orange would be grill, green would be pasta. So again, it makes it easy for the customer to walk in or the staff to walk in and say, this is what I want today, and I know which line to go to. The safe rail barriers are really important in social distancing, physical distancing, whatever you want to call it. You want to make sure that you have signage on the floor and also on the countertop. Not everybody looks at the floor. I know I've been in locations where they got arrows and I missed the arrow, and all of a sudden I look down and I'm like, I'm going the wrong way. So you want to make sure you got signage at eye level and floor, and make sure it's clear and they understand it. Because now it's so much, you know, people are starting to get used to it. I do agree with that, but I think you're still going to have a lot of, in the future, making sure that they see the signage. So in wrapping this up, robotics, you know, this is going to be the way of the future, whether it's delivery, making a salad, smoothie bars, coffee shops, pizza, burgers, you name it. There's a lot more with robotics, and we're going to see quite a bit in 2021. So I just want to say thank you again for the opportunity today. I really enjoyed Angelo. And now I think we're going to be turning this over for questions.
Awesome. Thanks so much, Nancy. And let's go ahead, and I'm going to stop sharing your screen. And then Angelo, if you want to hop on your video, then we can take questions from the audience. Perfect. All right. So we did have a couple of questions come in while we were talking, and by we, I mean you and Angelo. I did not do any work here. So a few things to start out with. Do you, and this question came through during Angelo's talk, but Nancy, obviously, if you have some feedback as well, I'm sure the audience would love to hear it. Do you charge for salad dressing in your salad concept, or is it included?
We actually build it in to the salad. So the base, our base is lettuce, 4 of the cheaper toppings, the 39-cent toppings, we call them, I think, choice toppings, and then 1 dressing. So that's built into the pricing structure. And we actually, I was mentioning our healthy food discount. If you choose a healthy dressing, I think it's 8 cents you save on your base. So that $4.99 that was on the screen drops by 8 cents if you choose a healthy dressing. And if your included toppings are healthy, you save 8 cents on each of those. So that $4.99 can drop to $3.69 by making healthy choices. And what I was saying earlier is that people do that. They get a healthy salad, they know it's only $3.69, and then they get sushi with it. And so we benefit both ways because they're buying more food, or they'll build a bigger salad. So sorry for the longer version of the answer.
Oh, perfect. We have some time, so I think that's great. Nancy, I don't know if you have anything to add to that. If not, we can move on to the next question.
Yeah, I don't on salad dressing, but I do think that the world of condiments is really going to be changing, and it's going to be different in the next couple months. You know, you got individually packaged and you've got bulk, and so I think the condiment world has definitely been a challenge.
Well, one other comment I'll make too is that half of our dressings are homemade. I think we're moving towards a whole homemade if possible. But what we notice is, 80% of the sales are the homemade items. I mean, people want the homemade dressings, and we call them out that way. It's not that hard to make honey mustard dressing. It's honey and mustard, some apple cider vinegar, ready to go. And so we let people know that it's a homemade item. We can also control the nutritionals better that way. So when we call it out, we have a carrot ginger dressing that we can control the sodium on as opposed to purchasing the item. And so with the push to be healthier, I think it gives us some more flexibility.
Awesome. And the next question came through while Nancy was speaking, so I'll let Nancy address it first, and then Angela, if you have anything to add, please do. Do you have any suggestions for soup packaging that works well? I think that was during some of your packaging discussion during your presentation.
Yeah, thank you. I think the best thing to do is to get with your broker, your distributor, and really look at the variety of different containers that are out there. But everybody is asking for disposables, so it's going to be a tough fall. I think that you want to make sure if you're going to be getting disposables, get them ahead of time. There's going to be quite a bit of a challenge to make sure that there's going to be enough in stock. But I think if you get with them, ask for some samples and do a little bit of testing, get with your chef, that you'll get a great product. There is quite a variety out there, but yeah, there's nothing worse than getting back to your location and, something spilled out.
And I just add, we spent a lot of time on it in the last probably year and a half, because we moved to a new container. And you're right, testing a bunch of different containers. It may have been compostable, but it kind of leaks. It's not thick enough, so people are burning their hands. And so you might have to spend more than you would expect, but you have to think of those things. Another thing we're looking towards is a container that is reheatable, like a microwave type container where we can do some specialty soups. So for a while, every other soup was vegan, and it was hurting our sales because we don't have that many vegan customers. I mean, vegan's important, but we don't have that many customers. So we're going to run a couple of vegan soups that we run every day in a grab-and-go case. So you can always get the vegan faux chicken noodle. You can always get the sweet potato, vegan soup, but you get to choose those every day and heat them in a microwave. So we have to find that container that's clear, that can get a nice label on it, that can go back to your office and heat appropriately. So we're still working on that. And if someone has something, send it my way.
Perfect. Okay, so the next question. The concept like bowls and salads made to order tend to create lines that hinder the distancing. We want to restart our bowls, but worry about this as pre-COVID, we would have had 10 to 12 people in line. So I don't know if you want to just provide some feedback or your thoughts on that comment/question.
Well, the app's going to save that for us, but if you can't do the app, if you use something like a catering software that you can, I've trialed that in the past where it's a less expensive option. If you're just not ready for that next step, ordering through a telephone. I mean, there's ways you can set it up where people can place an order ahead. I mean, we were doing with an app with Chipotle and Starbucks, but before that they were faxing orders to Chipotle, right? Before they had an app. And so we can do it. We just have to kind of be creative, because you're right. It takes time to consider, and it's a popular item, and we can't do the volumes we were doing before. And as we start to pick up, it's only going to get worse. And I'm starting to notice in our facilities that we're getting to the point where we're going to have to shut our cafeteria doors and allow people in one at a time, like a grocery store. So.
Wow. Yeah, I think that I was talking to somebody and they said what they tried to do was get 5 or 6 of the best salads and have those pre-made for grab and go to kind of offset for the custom. But again, if you can order online, I know I was just listening to a webinar where they were able to order ahead of time. So they knew if you ordered early in the morning, that really helped for pickup later. So encouraging people to order at breakfast time, what they would like for lunch. So again, that you're not getting a ton of people in line.
Yeah, and one thing I'll add to it is we're researching, and again, this is if you're fortunate enough to get your administration to agree to the app, is to further push people out of your cafeteria spaces. We're actually looking at a delivery option where we're saying we have a space that's far away, or it's an OR and we know they can't get out. And what we're looking to do is set up essentially a window. So if you order between 9:30 and 10:30, you get a 11 o'clock delivery. If you order between 10:30 and 11:30, you get a 12 o'clock delivery. So all we have to do is take those orders, fill them, and make maybe 4 or 5 deliveries during lunch. So it's not like we're constantly running up with one sandwich and one salad. People will order in those time periods. If they miss that time period, they'll order in the next one. And so we can then push people out, especially when we have distance issues, so we can keep them out of our spaces. And so the technology's there. It's just a matter of kind of working with our vendor partners and pushing them in some cases, saying, our healthy food discount, we went originally to our vendor and it didn't work in the system. But then we just said, hey, let's sit down and figure out how to do this, because it doesn't work now. Let's make it work. And we did. We ultimately came up with a really cool program that worked for some unique things that we had to do, but we just have to be creative, I think.
Awesome. Well, we have quite a few questions rolling in here, which is great. And we do have about 8-ish minutes left. So I can give my 2-minute spiel at the end. Everybody stay on for that. It's going to be super exciting. So Angela, what are your thoughts on redirecting existing labor within an operation to reduce or eliminate the need for additional staff?
I don't know, make sure I understand the question. So redirecting labor from like your cafeteria to go somewhere else?
It just says redirecting existing labor within an operation to reduce or eliminate the need for additional staff members.
I don't know that I understand it. Could that person clarify it and come back in a second?
Yeah, well, John, if you could re-clarify your question, we'll come back to it in a little bit.
John from my team, torture.
So, it might not be yet. We'll see. We'll come back to it. So, Angelo, how do you feel about retail sales post-COVID with all of your program changes in place?
So we get asked that all the time. Do we think people are ever going to come back? The IT people may never come back to the office. I don't have a crystal ball, but I would guess that people are going to come back to at least 90% of our capacity, because people like to eat. If we make good food, they're going to come to eat it. When you think about what's happening just kind of in the world, that, people, when bars open up, people went to bars, right? Because they couldn't wait to get back and be social and do the things that they're used to doing. And eating is something they're used to doing. So I'm confident that we're going to do as much, if not better. I'm hoping things like apps and some of the other programs where, ghost kitchens and some of the things we're doing are going to actually enhance our programs and make it better for us, because people are going to see us in a different way. They're going to start to think about food more than they may have, because some people are brown bagging it, right? And they don't go to the cafeteria. They've never gone to the cafeteria, but now we're delivering to their OR and they can try it. And maybe we incentivize them with some sort of a coupon to get them involved. Once we get the hook in their mouth, I think we're going to get them and bring them in as other customers. And of course, we've done things like these grocery sales and some of those things we're sending home. So how are we going to tap into those things? How are we going to get people to bring food home, whether it be meals or packaged items that we've been doing during COVID? And it's kind of wanes. Some people are still doing it really strongly. Some people are starting to slow it down, but I think our future is going to be bright with food, because people are, still going to need to eat.
Awesome. So I think we have time for maybe 2-ish more questions. So things keep moving. Angela, what are some of the key data points you're using in your health disparity study? How would you translate and connect cafe purchases to health outcomes? It's a bit of a two-part question.
We're actually self-insured. So we can, what our plan is that we're going to pick people from a certain cohort income, and then we're going to look at, we're going to have them sign up to be part of the program. And then we're going to be able to ask questions about underlying health conditions. So then we can do things like check A1Cs and check blood pressure. We already have a blood pressure program that's pretty robust in the health system. And so we're going to see before and after. So if we discount items to this certain level and they consume those items, that's our hope, is if someone comes in from housekeeping or food service and we give them a certain level discount and they have a special card that they go and use it for, and they get this special discount, we hope they're going to eat their breakfast and lunch or lunch and dinner with us. So then when they go home, they only have one meal to eat. And we're hoping that that's going to be enough to get them to have better health outcomes. And what we've anecdotally seen is that people who make less money are buying less healthy foods because it's a calorie per dollar model, right? A hot dog is cheaper than a chicken sandwich. So I'm going to get a hot dog that's going to fill my belly. And I can get rid of hot dogs, but if I get rid of hot dogs, someone's just going to go down the street to buy it. So I've not prevented the problem. I've just kind of, continued the problem. And plus they're leaving and they're less productive and all of those things.
Awesome. And then a question for both of you. What do you see as the alternatives to outdoor dining once winter arrives in facilities?
That's a
How much time do we
outdoor
have?
dining. Yeah. It's kind of a twofold too, because if it's hot down south, you can't eat outside during the summer. So, and then it's cold in the winter on the East Coast. I think, that hopefully as we move forward, things will go back to some normalcy and we will not have to worry about being outside. But I know people, when they've been interviewed and we've talked to them in surveys, they just feel safer outside and they've got, some fresh air. And but moving into the winter months, it will be a challenge. You may have the heaters, they've had a lot of where they put heaters out there and, try to keep it a little bit warmer. We'll just have to see what the future brings.
Yeah, and I agree with Nancy. I think we're in the Northeast, so we usually shut down outside dining anyways when the winter comes. And we're not doing a whole heck of a lot of it anyways. I think the app is what's going to help us, and hopefully it'll be up and running by the winter so that we'll be able to push volumes out through those months.
Great. We do actually have time for another question. I think it's one of our final, there's two more. And if we don't get to all of the questions, everyone, we can have Angela, and Nancy circle back to the discussion forums from this session within the system and just provide some quick responses in there, or I'll type it in for them later. So we'll just ask one final question here. Would an app that allows you to build your own salad bar similar to Subway or Papa John style apps and place a Cubby Fro pick up for a complete touchless solution?
Yes, I think I know. There was a concept that did that. I think it was called Pizza. And they were in San Francisco and Washington, D.C. I think it was a quinoa bowl. It was a quinoa concept, and it was completely touchless, similar to when you're saying ghost kitchens. I think it's a great idea. In fact, I was pitching at our places to shut our cafeterias down completely and just make them ghost kitchens, and that got shut down. But we're working on modifiers on that. But what this concept did is everyone was behind the scenes, and they used these cubbies. You went up to a kiosk, you swiped your credit card, and then the cubby would tell you when you order. So you never saw a person. In some ways that's really great. And then I think that what the company did is they just started to sell the cubbies because they found it more profitable for them. So they're available. I don't know if it's still called Pizza or not, but it was an interesting concept. They didn't have apps and things like that connected with them. I think they must partner with someone. But I think the whole idea of being completely touchless is interesting too. I'm not sure if it helps us in some ways. I think it might when you start to think about how precious space is in healthcare. So maybe we start thinking about producing foods off site that we're bringing in, like how many people are doing, delivery in our facilities before COVID. So how maybe we can capture some of that by being our own ghost kitchens, and they don't even know it's us, and we capture the sales anyways.
Yeah, I agree. The ghost kitchens, they started and they really have taken off now. And that idea of being able to have multiple, again, items served out of one kitchen. But with the food lockers, I think, they've been around for quite a while, honestly, for the last couple of years. But right now they're really, they're definitely with COVID, they're taking off more. But with your salads, everybody loves fresh salads and, that concept, the idea. I think the apps and ordering online kind of solve some of that. And having pickup locations, like you said, you might be able to start delivering to different areas in the hospital or different lobbies or different locations. So.
Perfect. Well, thank you both. We're just about out of time here, and I do want to end on time so that we can all rejoin each other on our Zoom call for our live happy hour. Thank you guys both for an excellent presentation. I know that the chat forum and the questions have been really, really active, and everybody really enjoyed your session. So thank you guys so much for putting the time and dedication towards this and towards AHF. We very much appreciate it. So before we sign off, I just want to remind everybody to please join us for our first virtual happy hour. We're going to have a number of happy hours during the coming 4 weeks, one per week, and this is our first one. So there is a session agenda item that is called the happy hour, and from there you can click the link to go right into our Zoom call where we'll all be on video together, and then we'll be breaking people out into smaller rooms so that it's a little bit more manageable. But this is a great way for everybody to connect and network and actually see each other in person. You can already see the three of us, but now we can see you guys. So we hope that you'll join us for that. And then we also hope, of course, that you will tune back in to us next Tuesday for our second virtual exhibit hall. We'll be sending out some additional instructions, but please do remember the exhibit booths are available 24/7. Our sponsors are watching their booths most of the time, so they will be responding in non-exhibit hall hours, but during those hours, they will be online and active and responding to you much quicker. So you can visit their booths, download their documents, explore their products anytime throughout the coming 4 weeks. And then during the live hours, it's a little bit quicker to get in touch with them. So we do hope you'll join us for that. And then of course, join us for our next live session, which will be our Fish Talks Q&A. We'll have our 4 fish speakers. Fish stands for Food, Innovation, Service, and Hospitality. They are our TED Talk style conversations. So we'll have a Q&A with each of our expert speakers for that. If you have not already done so, please check out the recordings. For those, we are uploading 1 or 2 that we're still waiting on, but those will be online for you guys all shortly. And with that, I am going to go ahead and close this out, and we are going to hop on to our live happy hour. So I will see everyone in a couple of seconds. Thank you guys so much for joining us, and thank you again, Nancy and Angelo.
Thank you.
Thank you.
Bye, everybody.